So nearly 190,000 COVID-19 cases have been recorded in South Africa since the beginning of the year. More than 4,000 people have died. President Cyril Ramaphosa announced last night that the country has secured 20 million doses of COVID-19 vaccine. Professor Shabir Madhi from Wits University joins me to discuss this. A very good morning to you. So we hear 20 million heading in our direction, but still the President very short on detail. What do you know about how soon we're going to get the vaccine and from where? What's the makeup?
Yeah, so good morning to you. So it appears, if you just do a back-of-the-envelope calculation, that much of that 20 million is going to be coming in addition to the 1.5 million that we're likely to get from AstraZeneca towards the end of this month. The remainder of that seems to be coming from what has been currently sourced through the COVAX facility, where South Africa sourced for vaccine up to 10% of the population, which is roughly about 12 million doses. And COVAX had indicated that they would be supplying vaccine from April onwards. So there's sort of another 4 million or so, or 6 million doses, which seems to have been procured over and above what is going to be available from the COVAX facility.
Should we be concerned that the variant could possibly be more resistant to some of the vaccines that are out there, our variant here in South Africa?
So the variant in South Africa is of concern when it comes to vaccine-induced immunity, but right now I'll be cautious in terms of overcalling it. We probably will get answers from the vaccine trials that are currently underway in a matter of the next 3 to 4 weeks. In fact, probably before the vaccine arrives, we'll know how well at least 2 or 3 of the vaccine works against the variant that's currently circulating in South Africa.
Are we in a good position to roll it out?
That's a difficult call. I think healthcare workers is something that we can accomplish much more easily than reaching out even to high-risk groups. The logistics of being able to implement an immunization program, which even targets 10 million people, and you're wanting to vaccinate them over a period of 3 to 4 months is enormous. And the planning for that needs to have happened already. And if not, then that's what the focus needs to be over the course of the next 4 to 6 weeks.
And those lucky enough to get the vaccine earlier on, would they have to repeat it at a later stage?
So that's currently an unknown. In all likelihood, based on evidence with other coronaviruses, at least in terms of natural immunity, it appears that immunity lasts for at least 2 to 3 years. So it's very likely that revaccination will need to take place, but hopefully not on an annual basis. In addition to which, if there is an evolution of the virus and it becomes evasive to the vaccine-induced immunity, that obviously changes the ballgame, in which case, yes, there might need to be more regular revaccination.
I know many private hospitals want to access the vaccine. You can understand that. Is it right that it's due to the government solely to roll out the vaccine? Should it be their duty?
Absolutely. It needs to be the duty of private hospitals. It needs to be the duty of general practitioners. It needs to be the duty of every pharmacy in South Africa. For South Africa to succeed, it needs to have a robust private-public partnership in terms of the rollout, including individuals, at least companies that are actually not usually involved in vaccines. As an example, Pick n Pay or Coca-Cola, in terms of their ability to distribute the vaccine across the country very quickly. So this is going to fail completely if government tries to maintain a strong hold in terms of who vaccinates and how vaccine is deployed. That has to take place through a public-private partnership, or else we're going to be in a bad space, even when vaccine arrives.
It's also going to be hard to get that transparency promised by Cyril Ramaphosa. I mean, it really is it's a pity, isn't it, that we weren't able to get our own vaccine here in South Africa, if you think of the impact it could have had on the rollout and how much money we could have made.
And unfortunately, that's a consequence of poor funding in the field of science. And it's not useful to start throwing a lot of money to researchers when a crisis is upon you. That is planning that needs to take place. And it's not just a failure on the part of government. It's also a failure on the part of academia. It's also a failure in terms of on the part of the private sector. Investment in terms of vaccines has been nominal. On the entire African continent, and that's the reason why Africa as a whole finds itself at the mercy of other countries and manufacturers from other countries.
Shabir Madhi, good to talk to you. Thank you.